Hello, my name is Rachna Mehta. I am a women's health and orthopedic physical therapist working at Hamilton Physical Therapy, located in Hamilton, New Jersey. So today we're here to talk about the treatment for pelvic pain. I would like to show you this model of the pelvis that we show our patients when we try to educate them about how we treat pelvic pain. So as physical therapists, we do a comprehensive physical therapy evaluation in which we look at all the bone structures and the muscle groups that attach to the pelvis. So based on your diagnosis and the source of your pelvic pain, we would be looking at the lumbar spine, which is right here at the back. We would be looking at the alignment of the lumbar spine to see if there is any misalignment that may be contributing to that pain. Coming down here, we would be looking at the pelvis, the bones of the pelvis, to see if there are any rotations there. Coming forward here, we would look at the pubic symphysis here to see if that is misaligned. And then we do an external evaluation of all the muscle groups attaching to the pelvis. So starting from the abdominals in the front to this lateral musculature and then the lumbar spine and the muscles of the back, we would look at that. We would also look at all the muscles attaching over here to the hip. So the quadriceps and then the hamstrings in the back and the muscles on the side of the pelvis. And then at the pelvic floor itself, so this is the outermost level of the pelvic floor. We look at these muscles and we use palpation to see where the pain is. After that, we would do an internal examination in which we would use a gloved finger and we would go internally, and this is what we're looking at internally. So as you can see, a lot of these muscles attach to the hip joint on the inside. And a lot of times our patients have hip dysfunction in which they lack range of motion of the hip, or they have pain that is with constipation or with defecation. So we try to figure out where the pain is coming from. Now the treatment for this includes stretching exercises for all the external muscle groups, and then we also do internal massage and external massage. So externally we would be working at all the muscles attaching to that, and there are different types of massage techniques that we can use for that. And internally we would be doing a similar type of massage, but we would be holding down on the points that hurt. Now some of these points are trigger points, meaning that they radiate. For example, say I pressed a point here and it radiates up into the hip or to the abdominals, then I know that that was the point that was causing them pain in those regions. Other than that, we do a lot of patient education in which we teach them how to relax their pelvic floor. So this is a biofeedback unit that we use at our clinic. It's an MR25 unit that we connect to a laptop, in which we can monitor their pelvic floor muscles. We can use external sensors or we can use internal sensors. And when the patient is connected to this unit, they can see what their pelvic floor is doing at rest. And then we can use breathing exercises and relaxation exercises in addition to instructions on how to relax their pelvic floor. And that concludes the treatment for pelvic pain. Thank you.